Welcome to the Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter @FoleyTom, and the hashtag The Virtual Shift. We have some special guests on the program today. We have Bert Fajardo. He is the Vice President of Strategy at Predictive Health Solutions. And we have Gregorio, Director of Center for Discovery, Innovation, and Development via the Children's Specialized Hospital, part of the Robert Wood Johnson Barnabas Health system. Welcome to the program.
Thanks for having us.
Today we're going to talk about a very critical issue that impacts a significant amount of revenue in provider practices, and that is no-shows. The stats are that roughly no-shows, when you have a scheduled appointment, no-shows range anywhere between 23 and 33% of all scheduled appointments in a given day. That's a lot of lost revenue, and so certainly the reason why we're talking about this topic today. On the flip side, it should be said that average wait time for an appointment with a physician as of 2022 is 26 days, and that's a long time to wait. I'm sick today. I need healthcare today. I really can't wait, and waiting 26 days is a very long time. So what are your thoughts on that, Vicki?
Yeah, so I would say it's certainly concerning. We know that no-shows are a major problem in the U.S. Right now, I believe the latest stat was that it's actually financially $150 billion problem for the healthcare industry at large. So certainly revenue impacts, but I would also say that wait times and no-shows in particular, that also impacts patient health. Obviously the patient who was there for that appointment, was scheduled for an appointment, needed that appointment, and therefore they're not going to have access to that care. And if it bottlenecked, created that wait period, obviously that's impacting somebody who could have utilized and filled that appointment and seen a doctor in a more timely fashion. So certainly agreed that it's a pain point, and has lots of ripple effects, financially and also operationally in healthcare systems.
And Bert, what are your thoughts?
Well, just to give you some context of how I got involved with this, most of my career was actually spent in banking and finance. So I was an IT executive in organizations like JP Morgan Chase, Citigroup, MetLife, UBS, where technology is a big thing, right? It's all about figuring out how to leverage technology in ways that to deliver value to our customers and patients. And then I left that sector in 2008 when banks were on the precipice, and fortuitously, I was hired to become a CIO for a healthcare organization. It was a shock, because of the state of technology in healthcare versus where I was coming from. And always being on top of technology, I was always intrigued with new trends. And of late, with predictive analytics and AI, it really showed me that we're on a new trend. This is not something that is going through a hype cycle. It's the beginning of something big. And so I believe that numbers, they tell the truth, right? And what ended up happening was that I was connected with PHS when PHS was formed by RWJ, Barnabas Health, and a company called Pinnacle Solutions, which has been in technology for 28 years. And what I saw there was fascinating on a number of levels. One was how far-reaching the problem is. The impact is huge to providers, to healthcare organizations, and most importantly, to patients, right? So that's how I got involved with it. Seeing how AI has gone so far and continues to evolve so quickly, and seeing what Vicki and her organization has done with it at Children's, I just said I had to be a part of something like this because it could have huge impact on so many stakeholders as well.
I just wanted to cover, because this is systemic, the larger issue in healthcare, and this is a very big issue because it obviously deals with revenue, and physicians are always trying to find ways to make more revenue because, the physician fee schedule, as an example, has decreased each year in the last 5 years. So, you can't have all these pressures on the physician and expect them to still be a non-charity organization. So the point there being is, to me, sometimes healthcare or health conditions sometimes doesn't hurt, if you will. There's no pain involved. There's no cavity in your tooth that's killing you, if you will. Right. But that you need to see a doctor. So it's easy to say, I'm busy today, I'm going to skip that doctor's appointment. So the question is, how do we change the behaviors? Educate first and change the behaviors so that the importance of attending a scheduled medical visit, as insignificant as one might think it is, or as significant as it is, but delaying it is even more significant, is on the overall system itself and my state of wellness.
Yeah, I think, again, it depends. I can speak at least from children's perspective. A lot of it, again, is connecting to the families. It's bare bones, right? It's not sexy, but it's important, right? Is that relationship with the families, and why it's important, an education and connection about why it's important to attend this child's visit. And, I could speak from that case. And I'd say that relationship piece is important across the board as well. But one of the things I would say, and I think everybody who would be listening in healthcare would say, yes, of course, but who has the time to do all of that, right? In terms of how do we have resources for those kinds of connections? Providers are filled with documentation time now that they're not necessarily being able to establish those relationships, right? And I think analytics can really help identify those patients or families, in our case, that really need that extra touch. That extra time input. Maybe it's not the provider, maybe it's other resources, depending on the hospital. Some hospitals have community health workers, some hospitals have social work teams. We have families that are embedded to our hospitals too, which we call family faculty, connecting with those folks as well, and really making them a part of the plan so that they're empowered. Because really, you could bring a horse to water, you can't make them drink, right? And I think that belongs in healthcare as well. So how do we do more with that? But using the analytics to help us with smart decision making and how we do it makes sense.
Bert, Vicky hit on two very critical points. One is relationships matter. I personally believe that relationships is the glue to better outcomes, no matter what the scenario is. If you don't have a relationship, there's no trust, and there's no alignment towards a common goal. And then the second word she used was empowerment. Is that when a patient feels that strong relationship with a health entity that they're quote unquote doing business with or looking to get services from, and when they feel empowered and they feel like they have some level of control and input, they're more likely to follow the plan. What are your thoughts on that?
I couldn't agree with you more. And I think what I was impressed by with children's and the whole approach that PHS takes is that this is not a silver bullet. You have to look at it holistically. So technology is important, right, to help you zero in on it. But it is about the people, and it is about the processes that you follow. And all three combined, right, in the right mix for the right location, for the right patients, for the right providers, that's what will have an impact. And so it really is about having a relationship with the providers and vice versa, okay, empowering them, but also having the patient feel there's a level of trust there because of that relationship with the provider. So, yeah, they may be upset, okay, that they have to wait a little longer than the norm in the waiting room. But in the back of their minds, me as a patient, I know that, look, I'm not leaving this doctor because he's great to me. But one of the challenges that organizations are facing as a problem initiated by no-shows is the frustration that this generates on providers. So the last thing a patient wants is to go to a practice where their provider left because they just had it with, the loss of time, loss of ability to really focus on the patient, because all the scrambling that needs to be done with no-shows and a whole host of other variables that they have to deal with in their profession.
Yeah, I agree. So with that frustration, I would imagine equally cost and operational impacts. Just expand on that a little bit more.
Well, in terms of, it's not just a lost revenue, right, for not showing up for the appointment. It's also, let's say, for example, you're showing up for an MRI, right, and the patient doesn't show up. Well, you have a technician that needs to be paid for. You've got equipment that's being unused. You've got supplies that are also, not being used up as well. All the time that the provider may have spent preparing for seeing a patient, that goes out the window, right? Where they could have been focusing on another patient. So it's far reaching what the ripple effect is that's caused by a no-show. I mean, I think comparisons have been done. Like if you look at that $150 billion a year price tag, an example could be that's the equivalent of 1 million patients requiring cataract surgery, right? So you could, throw variations on that, but the implications are huge on both people, processes, organizations, even value-based healthcare. It aligns very nicely with that because you're talking about things like, improving patient outcomes, reducing improving the financial bottom line on organizations. Patient satisfaction levels get affected by patient no-shows.
In what way?
Patient satisfaction levels?
Yes.
I show up and because they overbooked, now they're there 3 hours waiting for the doctor. I'm not coming back here. They asked to fill out a survey.
Gotcha.
And they get a bad score. What does that do? It's a ripple effect with the payer organizations because now the patient satisfaction scores, reputation of the provider organization.
The other thing I would just add is sometimes no-shows are like the flip of what Bert was saying with patient satisfaction, right? Folks may be done with the organization and not be showing up to their appointment because they're not satisfied for whatever reason as well. So again, like analytics could potentially shine a light on what are things that are operationally not working well in an organization. We found that out ourselves so that we could address those proactively to help reduce the no-shows, that apathy, I guess, to coming to the provider in general in that relationship. So I would say it can work both ways in terms of patient satisfaction.
So, Bert, let's shift the conversation to the solution side of the equation. I know it's been referenced a couple times in our conversation already, but predictive analytics. Do I see that? Do EHRs typically cover this, or is it, or as what you've done, a separate module that layers on top of an EHR but leverages some of the data within it?
So it's more that we take data from the EHR and run it into the models that we develop for our clients, right? So there's a plethora of information in the EHR, as I mentioned earlier. There's other sources of information that we use to enrich our database and model. And so it's a nice integration where it doesn't need to be complicated, right? With regards to an EHR, just feeding us and we feed back to them, right? So for example, if we get information from them regarding scheduling appointments, we feed back or they feed back to us if they actually showed up or not, or if they canceled late. And that just makes the model more refined and more accurate. We've got to the point where in some instances, and I don't think we mentioned this yet, but we actually score the actual patient with a probability. And we've gotten it to the point where it's around more than 90% accurate.
Based on historical data. So it's not...
Based on historical data and also weather patterns and, all the other
gotcha.
that I brought into play.
Well, that's interesting. So you're bringing in other elements. It's not just about the data that you have. It's
Correct.
About allergy season and weather and traffic patterns and things of that nature, other data elements that you wouldn't normally, a health system or a clinic would not normally, I mean, they're aware of it, right? But they're not aware that, an accident occurred on 295. You're from Jersey, so 295. And, patients are going to be delayed or not coming, right?
Yeah, it could be seasonality, right? So, for example, when kids are in school, whether the patient is the child or the patient is the parent, the fact that kids are in school, right, and they have events that may throw a wrench into the family operation, right? Vicky can speak to this very eloquently.
Personally too.
Yeah, exactly.
And so it may take into account also from a seasonality point of view. You know how it is when school season comes, kids get sick, right? And that throws a wrench into plans. So that gets factored in. Think of AI as something like, when you're dealing with a doctor and the doctor gives you a diagnosis or prognosis, you don't really tell the doctor like, well, explain to me how you came up with that. Same thing with these models, these predictive models. After a while, right, you trust the model because the outcomes are tested and reliable. Not 100%, but that's how our brains work, and that's what we're doing with predictive analytics.
Interesting. So, Vicky, Children's Specialized Hospital must have had a really significant problem to take this challenge under their wings and develop something that could better improve their operations. Tell us a little bit more about how this development came about and the investment that Children's Specialized Hospital allocated.
So I can say that, it's been a pain point for us operationally for a number of years, but I think we're not the only ones in this situation. I would say that Children's really was a thought leader in terms of, what are some things that we could, again, knowing that we had anecdotal information and we were making decisions based on anecdotal data. And it wasn't working for us, right? So we really felt like we needed to do more refined data analysis. We actually had had a meeting with Pinnacle Solutions, trying to identify, what are some things that we could do to really shine a light and be more specific in the data, for our solutions that we could have across the board. And really it came to be a partnership where they had a lot of the data, the data expertise. We knew more about healthcare and how to operationalize it. And it really made sense for us, for those two minds to come together and put something together. There wasn't anything else in the market like that at the time. There is this whole data analytics space for healthcare, but not really a lot of places that are doing it successfully operationally, because at the end of the day, operations people are not analysts. It needs to come to them in a way that's quick, common sense. Okay, what do I need to do with this information? They're not going to sit there and analyze and sift through the data. So it was really great that we had both minds together to develop an interface that was really using a lot of smart technology behind the scenes, but was something that could be easily consumed by our scheduling team, our providers, again, folks that really have to think on the fly and not necessarily have time to sift through data and analytics to come up with solutions.
And I think what's interesting, Tom, also the approach that they take is one of the first thing that needs to be done is let's take in data and see what the no-show landscape looks like. What does that data tell us from an analytics point of view of where are our pain points and how severe are they and which are the ones that we need to focus on, okay? Then the next step is to decide and agree on where to focus and start taking in data regularly. And that's where the predictive analytics come into play, where based on more data coming in, the model gets more accurate, more efficient. And now that's how we're able to come up with those scores, saying for these particular patients, this is the probability that they will not show up. And for those that are high, this is where you need to focus. But that's not the solution. The solution is now what do you do with all this information? Okay, that's where the people like Vicky come in and say, that's like almost getting a diagnosis saying, all right, I know what's wrong with you, and they're not doing anything about it. So that's where Vicky and her team would go in and say, based on what the predictive analytics is telling us, let's look at different approaches, intervention strategies, right? It could be with the patients, could be with the operations, and let's start making changes. But let's do it in a scientific manner. Let's not, throw the kitchen sink at it. Let's try this, see how it reacts to the model, if it improves. If not, okay, let's try something else. And the analytics will tell you if those approaches working or not.
A combination of the data, the analytics, the output of that has to be coupled with enhanced workflows and processes in order to affect the projection of what those analytics said. Is that what?
Exactly right. Exactly
So
right.
very interesting. So, and just a reminder to the audience, Children's Specialized Hospital has how many locations across New Jersey?
15 sites
15
across the state of New
locations.
Jersey.
Robert Wood Johnson's and Barnabas Health Systems, for folks that are out in California, may not be aware of who they are. They are very large and influential health system, above and beyond even what Children's Specialized Hospital is doing. So these are thought leaders in the Northeast, if not globally. So we have a very credible solution that addresses a very significant problem that helps mitigate loss of revenue. It improves operational scenarios and also improves patient outcomes, right? So, Vicky and Bert, with that, with the analytics in place, with the enhanced operational procedures to mitigate what the analytics is going to tell me, right? It's going to tell me I'm going to have a high no-show rate, and so that's where the operational aspects come into play. I got to be thinking that folks that work in offices are thinking, geez, another system. I already have a scheduling system. I already have an EHR. What's the complexity? And the question is, technology is technology, but we have to find ways to mitigate its impact, if you will, in the context of implementation and conflicts with other systems that they may have. Bert, tell me a little bit more about the effort to deploy analytics package that you're talking about from Predictive Health Solutions into a clinical scenario.
Sure, that's a great point you bring up. I think one of the other elements that enabled me to joining PHS, and this is based on my decades of being involved with large implementations, is the fact that this is a solution, okay, that will basically complement whatever like scheduling solution they have in place, connect with their EHR. As an example, it's not, okay, how do we get rid of what we have and replace it and go through a year-long, if not more, exercise of getting it ready. This is more about you give us the data, and our data will give you findings, right? Well, you give us the data in an automated fashion, very easy to make that happen. And then basically what ends up happening is because we're not ripping and replacing what's there, we're just guiding and giving them information that they now can figure out what to do with. They can be up and running and getting our solution to start evolving and getting refined literally in like 2 months, okay? I think it's going to take longer for organizations just to go through the red tape of giving us the data that we need. That's going to take longer than the actual exercise. Because, with HIPAA and all of that, making sure that they have the comfort level that this is secure according to all the regulatory requirements, that is something that may take a little longer. But implementation-wise, we're talking just a couple of months.
I'd say it's probably even less. I think that the red tape component, speaking from the from the healthcare end, it's more of the, again, making sure that we're all up and up with security and regulatory components. But I do think the solution itself may even take weeks to actually get going, again, depending on the level of complexity with the data. Because most things are in the EHR already, it tends to be a streamlined solution that can be analyzed pretty, not cleaned up as much, because again, there's regulatory stuff that goes into how EHR data is configured. But yeah.
Okay, so coming to a close here, spend a minute on a case study, a success story. To give us a case study where there was a big R based on the I.
Yeah, so I'd say I always look at the return more on patient care. Again, maybe that's the healthcare person in me. I could certainly talk about revenue. I would say that
patient outcomes is critical.
Okay. I can
absolutely.
say it's so at Children's Specialist, I can say it certainly has helped reduce, not reduce the other way, increase revenue in terms of correcting no-shows. I would say the biggest aha moment was more about, and I touched on this earlier, but I think it's important to hone in on, was we don't have a lot of great historical data on our new patients, but it was interesting to see, even just from like the demographic information, the Google APIs and all of that that contributed to what we had about our new patients. And then strategies that we really learned both from the data, but then also from the people that we worked with on ways that we could be welcoming our patients and making them aware of, what they needed to bring, like the parking lot, if there was a parking lot, because we have facilities in urban environments, so there's also public transportation needs, right? So really honing in on like the fact that we had to do a lot more with how do we welcome our patients and how is that helping us reduce our no-shows for those new patient appointments. And with that said, those new patient appointments can be, depending on the service, 3 times as long as like a recurring appointment. So they're there for us for an extended period of time. And conceivably, if they miss that appointment, that could not just impact one new patient, that could impact 3 patients, right? That we could have filled in for that appointment. Because again, some of our services are 6 months waiting periods, so those are patients that really need those appointments. I think the tool was really helpful in identifying that it was a pain point, but then it was even equally a wonderful thing to learn was that when we put in strategies of how we were reminding them, and it's not just a simple text, of those appointments and welcoming to the facility, how that impacted our no-show rates for those new appointments. And it was very, very successful, both in terms of patient access and revenue.
So building relationships, empowering patients, leveraging data, and creating an experience all drives greater retention of that patient within that health system and establishes that alignment. Excellent job on behalf of Children's Specialized Hospital, Vicki, and certainly Predictive Health Solutions on bringing this platform to market. It's going to make a significant impact in the overall market. So where do I go? Vicki, Bert, where do I go to get more information?
Well, for anyone that's interested in learning more about PHS, you can reach out to me at bert.fajardo, Fajardo, at PHS Technology.
And they're both on LinkedIn as well, Bert Fajardo and Victoria Gregorio. Thanks again for coming on to the virtual shift. You're always welcome to come back. That's today's shift. I appreciate the audience taking the time to tune in. If you missed part of today's episode, you can tune back in at the healthcarenowradio.com at the same time, 11 a.m. or 7 p.m. Eastern throughout the week. And be sure to check out the program page at thevirtualshift.co. As well, remember to follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, TheVirtualShift. I'm Tom Foley. Until the next shift.